even after taxes, you can get around 3 lakh easily.
3 lakh
For a,
easily.
if you want to become a registered nurse in New Zealand, you need to have at least 1 year of experience.
How about the future vacancies in Germany?
Most importantly, money.
Today with us, we have a very special guest, Harashita ma'am, who is working as a registered nurse at the New Zealand. A very warm welcome, you ma'am.
Thank you so much for inviting me.
Ma'am, can you just give a brief introduction about you?
So, I'm Harashita. I'm a registered nurse in New Zealand. I've been here for like 2 years now.
Okay.
And
Okay.
before that, working in India, AIIMS Delhi. So,
Yes,
yeah.
ma'am. And why did you choose over AIIMS over New Zealand abroad nursing?
Well, I think at that time I was thinking that bedside, like if you're in AIIMS or any other government hospital, there's a certain amount of work that you need to do, and there's not much growth. You will be a
Yes.
nursing officer till I think if you belong to a general category, especially, you will be a nursing officer for like 10 to 20 years. There's no promotion or any growth. Even if
Yes.
you want to do masters, there's no use of it. You will be still doing the same job. So I thought,
Okay.
let's try something else, and I went to New Zealand.
Ma'am, nursing in India versus nursing in abroad countries, and why the most of the nurses choose to go to abroad?
I think most importantly, money.
Yes.
In India, you don't get paid much. Government
Yes.
hospitals pay good, but
Okay.
private, you know already, they don't pay much. And second is you get like respect here.
Yes.
Even if you're working anywhere, any job, you'll get the same amount of respect as anybody else.
Okay.
So I think these are the two main reasons people choose to move abroad.
Okay. How much does a registered nurse at the New Zealand can earn at a month?
So it depends. Like it, you don't get a fixed salary. It
Okay.
depends how much you work, how much experience you have. Like for a fresh graduate, you can
Oh,
expect up to $40 per hour.
means
Doesn't matter if
in
you're working in private or government, pay is
okay.
the same. Nothing like there's not much difference, but it depends how much experience you have and like how much you are working. We get paid in hours, not in days. So if
Okay.
you're working full time at if you'll say 40 hours in a week,
Yes. Ma'am.
so 40 into 40. So
When
approximately, if you'll say for a fresher, just calculate. I'm not good with maths, so if you're getting $40 per hour, you're working
okay.
40 hours in a week. So 40 into 40, how much it will be?
160 in Indian currency, ma'am. How it will be?
1600
How
in a
much?
week.
Yes.
So 1600 you can do 1600 into 55. I'll
Yes.
tell you. 88,000 in a week.
88,000 in a week, ma'am.
88,000. Did I do that right?
Yes, ma'am.
Yes.
And
Before taxes. Before taxes. So
how
it's
much it will
1
be
week.
for a month, ma'am? For 1 month, how much it will be, ma'am?
352. Three. So even after taxes, you can get around 3 lakh easily.
3 lakh
For a,
easily.
easy.
Okay.
So depends how much you work, where you work doesn't matter, but how much you work and how
Okay.
much experience you have.
Yes, ma'am. Uh, yes, I think ma'am, I'm in the final year, and if I want to start from the now to how I should start for abroad nursing, ma'am, that is IELTS and OET.
So it doesn't
And
matter which country you choose.
okay.
Mostly, if you're going to any English speaking country, you need IELTS or OET. So start
Yes.
preparing from there. Then, if you're choosing Canada or Australia, you can focus on NCLEX.
Okay.
And in New Zealand, there It's easier than nclex. CBT is there, much easier
Yes,
than
ma'am.
nclex, but the pattern is the same. So that one. And OSCE, it's the practical exam, so just focus on your practical skills. It's not
Oh,
that much tough. You just need to focus on your communication. Skill work is not that much hard. So
okay.
where we lack is our communication skills, especially
Yes,
Indian nurses. So you can
yes,
focus
ma'am.
on rest. I think we are better than abroad nurses in terms of skills, but
Yes,
it's
ma'am.
just the communication part we struggle most.
That communication is only one of the barrier.
Yeah. Well,
And that
English is
okay.
not our first language, so and
Oh,
peer pressure.
that is a what is the criteria for the New Zealand, ma'am, to work as a nurse at the New Zealand?
Criteria as in?
Means eligibility criteria, ma'am.
Oh, for okay. If you want to become a registered nurse in New Zealand, you need to have at least 1 year of experience.
Yes,
Like
ma'am.
not 1 year, they say 1800 of hours, so it comes around 1 year of experience. Doesn't matter where you work, just 1 year of experience. It's better if
Okay.
you work in a good hospital, but it really doesn't matter. Wherever you're
Okay.
working, it should be eligible. You should be able to provide proof that you were working there, uh, not a reference letter or anything. They will, especially nursing council, if they have any concerns, they just email your employer. So your employer needs to verify that you are working there. So they need to send an email from their registered email address, not Gmail or any other account, especially their
Okay.
registered email address. That's the only proof you need for your
Okay.
employment. Apart from that, you need obviously IELTS and OET scores.
Yes, ma'am.
If so, if you're doing IELTS, you need 7 in 3 modules and 6.5 in writing. Same
Okay.
for OET, 300 in writing and 350 in other modules. You can combine your scores if you can't do it in single setting. That's the best
Okay.
part in New Zealand. You can combine your scores. PT is not acceptable in here.
Yes.
And obviously you are working as a registered nurse in India, so you should be registered with nursing council
Oh, yes,
wherever
ma'am.
you are working. So yeah.
Okay.
And your experience will be counted from the day you
Oh,
got registered, not before that.
yes, ma'am. Ma'am, which country is best, ma'am, for the nurses to earn? New Zealand or Germany?
Obviously New Zealand.
Hmm.
uh, right now I won't lie, there's not much job in New Zealand. Everyone is struggling. So
Yes, ma'am.
Germany is a better option if you are a fresher or you want to start your career just after graduating. So Germany is the best option for now because they are very supportive. I think they will support you from the day you start preparing, even if you don't get the job.
Okay.
Or like if even if I just heard that if you're preparing for your exam, they will support you throughout. So it's easier. It's just that you need to learn German. I think that's
Yes.
the hardest part there. But in
Language.
terms of money, I think New Zealand is better.
Yes, ma'am.
Yeah. Actually depends. Like depends on
Yes.
your future plans where you want to settle in.
Okay.
So yeah, right now if you're a fresher, Germany is obviously a better option than New Zealand.
Yes, ma'am. Ma'am, how about the future vacancies in Germany?
I am not in Germany, so I don't know much.
In New Zealand, ma'am?
But New Zealand, actually, every country, like any country, they are struggling with nursing staff shortage
Okay.
everywhere. It's just the government, they don't have much fund to give you
Okay.
jobs. That's the reality. Like New Zealand, Australia, Canada, they're struggling.
Yes, ma'am.
Germany is not that much struggling. They need nurses, so that's why they're just hiring everyone.
Yes, ma'am.
Like it's same like UK. Before UK was
And
the same. They were inviting everyone. So now it's
yes.
Germany.
You are also working in the AIIMS Delhi, ma'am. How was the respect, ma'am, from the here in India in the AIIMS and in the New Zealand? How it is, ma'am?
I think when you are asking for respect, you can't have it. You need to earn it.
Yes.
So even if I was in government, hospital, like one of the best hospitals in India.
Yes.
I had really bad experiences in terms of respect. I used to fight a
Yes.
lot. Not
That's
fight, argue a lot with staff, patients, relatives. But now I don't think so. It's useful. If you need to ask for it, it doesn't matter if even if they're giving it to you, you need to earn it. So I think it's our fault partially.
uh,
We, as a nurses, like we don't respect ourselves. How can we expect anyone to respect us? We are fighting among ourselves.
yes.
So yeah. But otherwise, AIIMS Delhi was, I think, one of my
Yes,
best
it was
experiences.
yes, it was one of the reputed.
Yeah, I still miss AIIMS. I won't lie. I still
Yes.
miss AIIMS.
Yes. Now the students are having lots of option regarding an NORCET, ESIC, RRP, and abroad. What is your opinion regarding
I
and
think,
what is your suggestion for them to choose them for their career opportunities?
especially if you are a fresher, go for everything. Doesn't
Yes.
matter which exam, where is it, which country. Apply everywhere. You don't know,
Yes.
your luck will get. Like, you should apply everywhere. Whichever comes to you, you should go there.
Yes.
But yeah, you need to work hard. So, especially for freshers, like your theory and practical both should be strong. Otherwise, you will struggle a lot. Doesn't matter if you're coming abroad or staying in India or anywhere. They,
Yes.
it's just that don't get private jobs and then struggle. At least you
Yes.
should have some backup. Yeah, that's true. But I won't recommend anyone to do private jobs. Just waste of time and money
Yes.
and your mental peace.
That's
Yeah.
Ma'am,
So
how did you started your journey from India, ma'am, for preparation of this OAT and IELTS? Whether you have chosen any of the agencies?
for OET or IELTS, I just did my preparation online because I didn't have time to go for coaching or any classes. I was
Yes.
working full time and seriously, I'm so I don't know how to say it. I'm not that much hardworking or punctual. I just study last at the last moment. So I just did my online studies. Even if I had to, I think I took classes online for my. I did OET, not IELTS. So I did my
Yes.
OET. I prepared online. I use study modules. Everything is available on YouTube, and I use Telegram. This people don't know that Telegram has so many groups. You can just join them. Everyone is preparing there, so you can just have your doubt sessions. You can practice with them. So I think that was the best part that I got to know that one. I didn't like officially did any coaching for that one. So yeah, it doesn't like it's not that much hard. You just need to
Yes.
open up.
Yes.
So yeah, you can do it yourself. You don't need to do like any coaching or any special course for that. OET is a expensive exam, I would say. So don't waste your money on coaching or anything.
How much expenses you have spent on for preparation?
I think when I did my OET, it was around 45,000 the exam or 37.
Yes.
I don't remember. It's been long, but yeah, it was costly. And when I did my New Zealand nursing registration, the process was completely different from now. Now it's much cheaper. You can do the whole process within 4 to 5 lakhs, not more than that. Even
Okay.
if you want to apply yourself, you can do that. You don't need to apply through an agent or anything. It's just that when you're preparing for your OSCE,
Yes.
in my opinion, in my experience, don't take coaching from India. It's better to come here and get coaching from here because the work culture, the prep, the setting, it's completely different from India. They are not
Yes.
judging only your clinical skills, they are judging your communication skills as well. So it's better if you prepare here because the teachers are like specially for us. We know how to speak in English, but it's just the accent we don't know. We are not sure about. You can speak English, but you need to understand what they are asking. And if you don't understand their accent, their English, then you will struggle. So it's better to come here. Just come 1 month before your exam. take classes from here. I think they have so many coaching centers in here as well, in New Zealand as well. So better
Yes.
come here, get your coaching, and it's much cheaper than in India.
Yes.
That's the surprising part when I heard the price in India and the price in New Zealand.
Yes,
There
ma'am. What is the price here in New Zealand, ma'am, for the preparation
usually
coaching?
so it depends. Like if you want to get your class, like if you're just doing 2 weeks of prep, so
Yes.
there will be a different amount. If you want to prepare for the whole month, then it would be different. But it's around $500 to $700. It's not much. In India, they're charging a lot. I don't know what they are teaching. I don't know. I don't want to judge or anything, but I think it's not fair. So it's better to come in here. Do your CBT in India. That's all right. Do your
Yes.
IELTS, OET, everything there. But for OSCE, come to New Zealand. You come for OSCE in New Zealand. I think if your exam in, like, suppose you're having exam on 2nd of January, so come in December, 2nd of December. You have your whole month prepared then, and then give the exam. Don't go blindly and then just struggle. I got so many messages. People are giving OSCE again and again, and they're not clearing the exam. And when
Yes.
the same pattern was, there were the coaching centers were in India or their teachers were Indians. Not, I am not being racist or anything. It's just like it's better if you prepare with their people, like the Kiwis. So it's better if you prepare here. Not. I won't recommend anything from India. And you got to hear like so many scams are happening now. They are
Yes,
giving
ma'am.
fake visas, fake joining letter, blah blah blah. So
Yes,
it's
that
better
is
to
one
come
of the
here.
biggest problems.
Yeah. So
And how is the workload, ma'am, from compared to
I
India
work
and New
in
Zealand?
Delhi, one of the most busiest wards. So for me, it's so easy here. I won't
Yes.
lie. The paperwork is hard. Like in India, we are just, you still using paper charting. We are just writing everything. Here is
Yes.
everything is
Still
electronic.
they
So,
still
but in
still they
here,
are complete different paperworks, ma'am.
it's different. So everything is electronic. So
Yes.
you need to be fast, accurate, and like if, for example, if it says your vital signs should be done every 30 minutes, so it should be done every 30 minutes. You can't skip that one. It will trigger, so everyone will know that you haven't done your jobs. So you need to be very efficient. That's the hardest part, but patient load, it's manageable. It's not that much hard. It's just the documentation that you need to be worked upon. But I think you just need some time, and you'll get used to it. So yeah.
Yes. I think, ma'am, I have completed now BSc nursing, and I don't know any of the career opportunities in the future, whatever the in our India and abroad. But I want to start my preparation, ma'am. Whether I should go for the NORCET or for the OET or the IELTS. What is your suggestion, or what is your opinion about it?
It totally depends on you what you want.
Yes.
You need to understand. If you're preparing for NORCET, that's a nursing exam. If you're preparing for OET or IELTS, that's just English requirement. It's not related to nursing. If you're
Yes.
preparing for NCLEX or like any CBT or anything from the for the abroad nursing, then it's completely different. Don't compare NORCET and IELTS or OET. They are completely different. IELTS and OET is just English requirement. You don't
Yes,
need to
ma'am.
study too much for that. It's just 20% of the struggle. The real struggle is when you get everything, you need to apply for the job. That's where the real struggle starts. So just choose a
Um,
country where employers are supportive. Like in New
yes.
Zealand, you need, even if you do everything, you need to, even if you got your registration, still you need to apply for the jobs yourself.
Yes.
And right now, the job market is not so great. Yeah.
Ma'am, in New Zealand, ma'am, you are working as a registered nurse right now, ma'am.
Mm.
But the what is the basic salary will be there for the nurses at the freshers, ma'am, and how much they are will be able to save for the month?
I just told you around 3.5 lakh you can earn, and then if you want to save, it totally depends on your expenses. Like if you want to come here and then start buying stuff, car, house, then you won't be able to save much. So like for me, I am not a fresher. I
Yes.
am on step 5, I think. So, and I don't work much. So still I can save up to 1 to 2 lakhs easily.
Yes.
Easily, yeah.
How, yes, ma'am. How much will be the tax will be deducted, ma'am?
So in
Tax.
New Zealand, the tax is not fixed. There's a tax slab depending upon your salary. So like the new, what do you say that one? When the new, like in April, new financial year starts. So you will
It's
get,
month.
yeah. So they will start a new year from there, no? So
Yes,
I
ma'am.
think up to 17 or 18,000, your tax slab is different, and then it goes up and up. So minimum is 17%, then it can go up to 33% depending upon your annual income. So it's not fixed. So
And
working
how
here,
would
you can
the
say,
yes, ma'am.
huh?
Yes, ma'am.
Usually you can just, I think 30% you can say.
Yes, ma'am.
Then you got your TV saver, it's like a PF.
Yes.
PF or I don't know. TV saver is for everyone, not in nursing, for everyone. Like I contribute my part, then the employer contribute their part, and then we can withdraw in our later on. I think after 67 years of age or something. I'm not sure about that. It's like retirement funding,
Yes.
so that also goes. Then we got ACC. If you had any injury or anything, then they will cover your expenses. So like that, so many cuts. So yeah, if you earn a lot, you need to pay a lot in taxes.
Then, ma'am, what is your opinion about the 80:20 ratio, ma'am, in Norset?
I was when I cleared my AIIMS exam, Norset. I was the first. I think we are the first ones who cleared Norset. Norset one.
Norset one.
Yeah. So I don't like. I'm not in favor of 80-20. I hate 80-20. I don't know why they applied it. It doesn't make any sense to me.
Yes.
So yeah, I I'm not in favor of 80-20. Especially if like everyone is working hard, everyone has struggled for their degrees and their exam, everything. So why do they want to put 80-20? Any reservation actually. Any kind of
Okay.
reservation, I'm not up to that. I hate reservation.
Yes.
Hmm?
And then anything you want to tell about to the viewers and from the Karnataka and from the India or
What I would say. If you're a fresher, study hard, don't stress too much. You have your whole life and you could do so much. And even if you want to go to abroad, don't stay still like, okay, I'm here, I lived my life, I don't want to do much. You can do so much with your life. Don't just stay at bedside forever. Study more, you can do a lot. Nursing,
yes,
you have so many options. If you're
yes, ma'am.
coming abroad, then even still, it's been 2.5 years now, I'm still exploring so many options. Like you can do so much. If you don't like hospital, you can go to community. If you don't want to go to community, you don't like patients, you can just stay, work at home. We got work from home option as well. So many
Yes, ma'am.
options. If you want to go to teaching, yes you can. If you want to do your own research, you can. If you want to be a nurse practitioner, nurse prescriber, there are so many options. So just don't stay at bedside forever.
Yes.
Just work hard, don't stress too much. That's all. And dream big. Dream
Yes,
big.
ma'am.
सपने ऐसे देखो जो तुम्हें सोने ना दे.
That's correct.
That's my motto, I think. If you want to achieve something, go for it.